abduction, abduction, external rotation, so I want to do two of those at the same time. Okay, so what I'm going to have him do is I'm going to say put this right here, okay, above the knee, and then just relax the knee, okay? He also has to relax his head, which is also going to be an issue, okay? Since he's nice and flat and his hip isn't popping up, I don't have to worry, he's negative. If your patient is up here, okay, that's a problem, okay, because that means that they're tight, okay? What's my next test? Gainsland, can you stand for me? Okay, I have to stand for this one, so what I'm going to have him do is I'm going to say, as you're at the end of the table, I'm going to have you grab a leg at your thigh, okay, and you're going to roll back with it. And I'm going to kind of catch you when you're up here, okay? Good. So what I typically do is I put this with a towel on my shoulder so that I don't have to, like, push forward, okay? My hand goes here, right next to him, so he knows that he's the one, you know, controlling this movement. My leg goes across, and what I'm seriously going to do is I'm just going to push his hip flexor to see if there's tightness, okay? Tightness isn't that big of a deal because this is a traditional hip flexor stretch, and here's the hip flexor that we're having problems with, whether it's iliopsoas or rectus femoris, okay? If he gets SI pain, okay, if he's got pain in the lower back at L4, okay, if there's any other problems going on where his legs are going numb, it's all positive. Is that tight? And that's Gainsland. Bring the other one up, have him hold both legs. Good, now sit. Okay, make sure you help your patient up. If you don't help your patient up, I'm deducting points. What's next? Okay. I'm looking for SI dysfunction. Where are my sacroiliac joints? My sacroiliac joints are right here. It's where my hip meets my sacrum. It's right here. Okay, so that's where I'm really looking. Okay, and what I want to do is I want to compress those two joints. But they said posterior. Can I test them on a sideline? Absolutely. Okay, I'm going to show you how the book recommends you do it. So I'm going to move his hands. Can you put them up here for me? Is that comfortable for you? Good. Okay, people don't like this because they're very ticklish. Yeah. Okay, in the area. All right. I'm going to find his iliac crest. My hand goes here. Okay. My other one's going to find his other iliac crest, and my job is to push back and down. So I'm compressing the sacroiliac joints together. Okay? So I'm here and here, and I'm pushing. And if I push and it gives him pain, okay, it's compression. I'm compressing the area. Okay? And it's a ligament. There's ligaments in there. They get irritated. The second thing I can do is I can go ahead and do compression. Compression you can do in two different ways. I can have him here, and I can squeeze him together. So I'm trying to distract the SIs, or put him on his side. Okay, just like this. Okay, especially if you're one-handed. Okay, and you can just push him this way. So I'm pushing him in this position. Okay, I'm trying to get those SIs to come like apart. Okay, so that's distraction. Okay, next. Trendelenburg, can you stand for me? So for Trendelenburg, I need to know a couple different things. Okay. First of all, the leg that he's standing on is my positive leg, okay? Don't hit the table, so scoot to the side. Take two hands on your hips, okay? And I want you to go ahead and lift one leg, okay? See how his hips don't change? They're still level. Or if the hip comes up a little bit, that's all negative. If he comes down, okay, which I'm going to actually show a couple people what they look like, it means that the leg he's standing on, the glute medius, is weak. And so if you have a patient who has this, or either born with it, or you know, they developed it because of an injury, and when they talk, it drops with every leg. So here's my leg, it drops. Here, it drops. Here, it drops. And so what they do is they walk like this. Okay? Which is a very good exaggeration of what it looks like, but you will see people with this pathology. Okay? Next.
Candles.
Candles? Okay. For candles, I'm going to have you lay back. Okay? I want to be on the side that's not raised. Okay? So what I want you to do is I want you to take this leg, grab onto the back of your thigh, and bring it up to your chest. Okay? My job, before he does this, is to feel his back. So leg back down. Okay? Hand here. He doesn't have a lot of lordosis. Okay? Bring that leg up. Since his leg goes flat, he's neutral. There's no problem. Okay? If I went through and I kind of could put my hand through and then he brings his leg up and I can still put my hand through, it's all for lordosis.
Thompson test.
Thompson test. Okay, we're going to do the same thing we did last time, but I'm going to stay at your side. Okay, so I want you to reach back with one leg, okay, and I want you to bring it back. Good. Okay, nice and relaxed. If this leg isn't level with the table, it's positive. Why? For iliopsoas. So what his leg will look like is it'll look like this. Okay? When I do it, that's what it looks like for me. Okay? Second thing I want to go ahead and do is 45. Okay? If this is 45, which is right about here, or up, it's positive for rectus femoris. Now, I've been kind of testing him the whole day, so he's getting a little looser as time goes on. Okay? So if someone is here or higher, it's rectus femoris.
Obers.
Okay, on your side for me. I don't care which side you want to go. Okay, so I want to take my bottom leg and bend it, okay, because I don't want him falling off my table. Scoot forward a little bit. Sure. Okay, so Obers is for my IT band, okay? I'm going to bring this one forward, okay? You want to make sure you have full stabilization of your patient. So what I do is I take my hand, it's a passive test, and I'm right here. So I have full control of his leg. My other hand, stabilizing, relax your body. Relax your body. Almost. There we are. Up, back, and down. And what you want to do on tables, which is really, really nice, is slowly lower him. Okay? If his IT band allows you to go to the table and below, it's negative. If I tested certain people where it's really, really tight, it'll stay up here. And that'll be positive for IT band tightness. So my next one's going to be noble. These are normally together.
Yeah.
Yeah. Okay. On your back, please. Okay. Same idea. I'm going to show you where my condyles are. They're on my femurs. Okay. So tilt this toe in. Good. That's my tibia. If I come up, I'm going to find my condyles. Okay. Same thing here. Bend. Tilt in. Okay. Tibia, meniscus, condyles. All the ways you can find it is if you're on the inside and you know where your condyle is and you know where your adductor tube is, just come across. So you want to be right above the condyles. Why? It's one of the areas that where the IT band can snap. It can snap at my greater trochanter and it can snap at my condyle. So I want to be in this position. Okay? And what I'll do is I'll put my hand here. Okay? I'll hold here and it's a passive motion. For those of you with only one hand, have the patient move them. Okay? And his patella snaps. Okay? But his IT band does not. Okay? IT band tightness.
No,
Nelson's line? Nelson's line you can do it a lot of different ways. Usually it's sideline. Okay? So lay on the side for me. I'm looking for two things. Okay, two landmarks that we looked at earlier. Okay, I'm coming up to his hip, coming to the front to my ASIS, coming directly to the back to his ischial tube, and I use my goniometer because I have it, okay, and I make a straight line. Can you put your legs straight for me? Good. And what I want to do is I want to come up the actual hip till I find my greater trochanter. Since the greater trochanter is underneath the line, it's negative. If it's at the line or slightly above the line, it's positive for coccyvalga. So coccyvalga means that the actual hip itself isn't wide enough, okay? It's 120 or below. I know that it says 125, but the actual numbers that we talk about are really 120 to 135, okay? So this is normal. This is coxivera. And here's a problem with coxivera. If I have it bilaterally or even on one leg, okay, it forms a valgum at the knees. And if I have a valgum at the knees, that's going to lead to ACLs, PCLs, medial menisci, okay? So if you ever have Nicole and you have her jump off of something, her knees go together, okay? So we need to really fix her because if we don't, there'll be some issues, okay? Because she can blow out an ACL, okay? So I'm going to show you Trendelenburg, for example, on Melissa, and I'll show you this kind of an angle when people jump off of something. Just a few minutes. Next.
Piriformis test.
Piriformis test. Okay, piriformis test, you have to be in front of the patient, so patients do like this. Slide towards your knee just a little bit. Good. My hand is up on the hip, okay, and I'm going to go ahead and take this knee, relaxed, okay. I'm going to bring him up over in here, okay. Piriformis sits here, it's a T-shaped muscle, okay, it comes down as a T-shape, okay. So when we have that and it's pushing into my sciatica, This right here may give him either tightness here and or radiating pain, tingling, numbness to his leg. Okay? Pain here is tightness. Tingling numbness means it's compressing the sciatic notch that goes through that greater sciatic area of our back of our hip. Next.
Long sit test.
Long sit test. Come over here on your back. Sit there. Right there.
And just
Okay.
sit there.
Take these, put them on the table. Okay? Lift your hips up and down. Okay? I'm just neutralizing his hips by doing this. Okay? I'm going to take this and bring it out. Okay? As I look, my hands go underneath the medial malleoli. Okay, right down here. Okay? And I'm going to line them up. Sometimes, if I have a bigger person, I may have to lift their legs a little bit to make sure that they're level. And he is level. Okay? I'm looking for either one side to go short or one side to go long. Okay? So go ahead and sit up for me. Good, 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 good. I found a pathology. Okay? His left leg became longer. Okay? Now think about this. When he's laying down, if they're normal, okay, I don't have to worry. If he sits up and the leg becomes longer, it means that this pelvis shifted down when he sat up. If it becomes shorter, it means that the hip came forward and it pulled the leg back with it. Okay, so you need to know the differences and where they are. You may have to do this one or two times to go ahead and make sure that you have it right. Okay, so if I look at him here, okay, his left is just a tiny bit longer. Okay, and you go from there. Next.
Ellie's test.
Ellie's test on your back. Okay, flip over for me. I do a pre-test. I do a pre-test before I do this. I say, can you bring your heel to your butt? Does that give you back pain? Okay, that's my test because I worked with a chiropractor too long and I learned there's lots of lower back problems, which is why people go to chiropractors. All right, so what do I do with this test? Okay, I'm really looking for hip flexor problems. Okay, so I'm going to have him here. My hand's going to go underneath and hold. Okay, I'm going to stabilize. I'm going to bring him back. Okay, he should be at 90 at his knee, and I'm just going to bring him back. Okay, if his knee automatically goes back to the table because there's so much spasm or there's so much of a contraction, or if I do that and I can't get him off the table, okay, or if he's screaming, I'm in so much pain, it's tight, okay, it's all positive for hip flexor.
Hip score test.
On your back, please. And again, I'm doing it on this side so you guys can video. So this leg goes down, the other leg bring up, okay? It's a passive test, okay? I'm short, so I like to be up high, but you don't have to be, okay? You can do it from here. And what I typically do is I stabilize the arm, I come across, and I touch the top. If you're one-handed, you can do this, okay? If not, you just take two hands on the top, you're going to push it down into the hip, and you're going to rotate the hip, just like you would as if we were doing an Apley's compression, okay? If it gives him pain in the hip, it's either general hip pathology, potentially a labrum, so we'll have problems in the hip itself. Next.
The 4 bonus points that
Okay.
I ran in position
It's
evaluation.
Renee. Come here again.
Yeah.
Okay? He's going to sit at the end of the table, kind of side of the table, okay, holding on to the table so that if he falls, he can catch himself. And I want him to only bear weight on this leg, the outside leg. Why? Because I can't be on the inside. I can't figure, I don't fit in that area, okay? So what I want to do is I want to find his condyle, okay? So bend your knee a little bit, okay, and I know it's going to be right here. Relax, okay? I put my thumb on it, okay? If I need to come across, I can with my fingers, but I'm really just pushing on this bone right here, okay? Right above the bone is where I'm going to be. And I'm going to say, okay, do me a favor. This hand, if you feel like you're going to fall, you can hold on to my shoulder, okay? What I want you to do is I want you to come down to like a half squat. Don't fall. Good. And back up. Down again. Back up. One more time. There you go. One more time. Good. And what I'm looking for is I want to see if that IT band is going to snap over the condyle. Okay, if it snaps over the condyle, it's positive. Okay, for IT band tightness. Now, I'm going to show you a positive chin down bird.